Good morning. My name is Shan Raza, and I'm going to give you a brief introduction to computational pathology and how you can apply your computer science knowledge in real-world problems. So before we start, let's have a look at what is histopathology. Histopathology is the study of disease. It's the study of cause and effect of disease, usually by examining the cellular or molecular structures in bodily fluids like blood, or tissue specimens, for example, tumor, analyzing them under the microscope. It involves tissue slide preparation, slide examination, and diagnostic reporting. So let's take a step back and let's have a look at what happens for a patient through a patient journey in real-world situation. So if a patient has feels some unusual symptoms and they feel trouble with their gut, or they feel any other problems with any other part of their body, they visit the GP, and the GP, based on the symptoms, they can suggest some tests, for example, ultrasound and CT scans. And if the suspicion is for cancer, for example, then these patients are referred for biopsy collection, or they are referred for surgical resection of tumor. So once these tissue specimens have been collected, these tissue specimens must be analyzed for the diagnosis of the disease. The histopathology, the pathologists usually they need to preserve the tissue in lifelike state, and to perform that they use formalin, which is a strong disinfectant and also hardens the tissue. So these tissue specimens are then fixed into paraffin blocks. So then these become tissue blocks, solid tissue blocks, and these are then cut with the help of sharp knife, with the help of a microtome, into very thin 3 to 5 microns tissue sections. These tissue sections are then transferred onto a glass slide, which is usually transparent. So there is no color for this tissue specimen at this stage. The pathologists then apply some dyes to visualize the structures in the tissue, and these slides are then analyzed under the microscope for examination and for the diagnosis of the disease. So in a conventional histopathology lab, following the resection of the tissue and after slide preparation, a pathologist would analyze these slides under the microscope, generate a pathology report, which is sent to the clinician or an oncologist, who will then suggest the treatment for that patient. What happens in the digital pathology pipeline is that the microscope is now replaced by a whole slide image scanner, which digitizes these slides into large whole slide images. The average size of these whole slide images is about 100,000 by 100,000 pixels. So there's a lot of data which we need to process to analyze these images. So in a digital pathology workflow, these images are analyzed again by a pathologist, who generates the pathology report, sent to the clinician, to the oncologist, who will then suggest a treatment for the patient. In a computational pathology workflow, and that's this module is about, we add something called machine learning assisted diagnosis. So we take these large whole slide images, these large images, and then analyze these images with the help of advanced computational algorithms, advanced AI, deep learning algorithms, and then provide some statistics and data to the pathologist, who combines these statistics with along with the visualization of these tissue specimens, and generate a pathology report, which is then sent to the oncologist, who will then suggest the treatment. So if you look at this data, this is how a tissue slide looks like under a microscope. If you look at these tissue specimens with the help of a naked eye, they are the size of your thumbnail. However, when these are scanned with the help of the whole slide image scanners, these are roughly of the size 100,000 by 100,000 pixels, and you can see they look like a massive Google map image. And we need to analyze these images usually at the highest resolution. So where can our computer science knowledge help us in analyzing these tissue specimens? So one of the examples is breast cancer grading. A well-known breast cancer grading system is the Nottingham breast cancer grading system, which is utilized all over the world, and it was developed by our colleagues at Nottingham University. It involves scoring the tissue specimens using three different criteria. One of them is gland formation, the other one is nuclear atypia, and the mitosis count. So gland formation, they score the tissue specimens as 1 if more than 75% of the tumor forms glands. They score it as 2 if 10 to 75% of the tumor forms glands, and if less than 10% of the tumor forms gland, then the gland formation is scored as 3. Nuclear atypia is the measure of the how regular or uniform the nuclei are in the tissue specimen. So if there are small, regular, and uniform nuclei, then the score for nuclear atypia is 1. If there are moderately increased in size and there is some variability, then these are scored as 2. Otherwise, they are scored as 3. And finally, there is a mitosis count, which is done. This is to measure how fast the cells are dividing in the tissue. So if the pathologist counts 0 to 9 mitosis in 10 high power fields, then it's scored as 1. If it is between 10 to 19, then it's scored at 2. Otherwise, if it is greater than 19 mitosis, then they score it as 3. And then the Nottingham breast cancer grading system combines these scores, and based on the final scores, for example, if the score is between 3 to 5, then it's grade 1. If it is between 6 to 7, then it's grade 2. Otherwise, if it's higher, then it's grade 3. And depending on the grade of the tumor, the oncologist then suggests treatment for the patients. So this is how it looks like. The images look like under the microscope or once they are scanned using the whole slide image scanner. So the first example you see on the left, it's the low-grade gland formation where the pathologist will score them as 1, where you can see there are some glands being formed there is some structure to the glands, which you can see in the image. The image on the center, you can see there is some structure to the glands, which is highlighted in the green boxes, whereas there are regions outside these green boxes where you see there is no structure to the glands, and that's scored 2. And if there is no structure to these glands, then these are scored as 3. Nuclear atypia is as we mentioned, that's to assess how regular or uniform the nuclei are. And if you look at the image on the left, you can see the round uniform nuclei, which change in grade 2, which is in the center image. You can see for score 2, there is some irregularity to the size of the nuclei, and they look at a bit increase in size as well. And then on the image on the right side, you see large nuclei in the image. And then the mitosis count. So this is the overlay. As you can see on the image on the right, the size of the nuclei increases from left to the right. Finally, the mitosis count. Mitosis, as you know from your A-level biology, that the mitosis is the process by way of cell division, and in cancer, the faster, the higher the number of mitosis, the higher the number of cells which are dividing, the grade of the cancer is higher. The score of the cancer will be higher for mitosis count. So these are some examples highlighted in green for the mitotic cells, and the pathologists usually count these mitosis in the high power fields, and based on that, generate the score. So what we do in computational pathology is that we develop algorithms not only for grading of for gland formation, not only scoring for gland formation, we can develop algorithms for nuclear atypia, and we can also develop algorithms for identifying mitosis. And based on these counts, we can generate automated scores and provide a pathologist with the number of with the scores for gland formation, the scores for nuclear atypia, and the scores for mitosis count, which can then be combined for grading cancers. So in a computational pathology pipeline, um, we have looked at just one example for breast cancer grading, but for other types of cancers, we may have a different pipeline, we may have a more complex pipeline. So in general, what we have in a computational pathology pipeline, we get the data in the form of images. It can be stained with regular pink and purple stains, which you have looked at, the H&E, which we call H&E stains, but there can be other types of stains as well, which we get as images. In addition to these images, we get clinical information, we can get other types of tabular data as well. Combining this, we develop machine learning algorithms, mostly based on deep learning and AI, and calculate the statistics, try to predict not only the trajectory of the disease, how the prognosis, how well is the chance that the patient will survive, how long they will survive, and the statistics which can be used to predict the treatment for the patient as well. So that's what I wanted to talk to you about for in this brief introduction. But if you have any questions, I can explain further as well. Thank you for watching.